Hi there, everyone. Welcome to Now You're Here, Now You're Not, preparing your pet for yet another change, because that's what we all need right now, right? My name is Christy Keith, and I'm a Senior Communication Strategist for Fear Free. Before I introduce our wonderful speaker, I'm just going to very quickly take care of a couple of housekeeping items. First, we'd like to thank our friends and Fear Free sponsors at Ceva for making this webinar possible. We'd also like to thank all of you for making time for this webinar this evening and for turning out in such huge numbers for the entire series of COVID-19 related webinars we've been doing on a nearly daily basis for the last 2 or 3 weeks. Your dedication is just so inspirational to all of us, and we're just thank you very much for everything that you're doing for the animals, for the profession, for Fear Free. Thank you. Just want to let you all know, because everyone always asks, yes, this is being recorded and it will be available within a few days at fearfreepets.com/webinars. So you should be able to view it or share it with your colleagues anytime after a few days from now. Dr. Tynes may have time for a couple of questions at the end. Please ask them using the Q&A window, not the chat window, as soon as they occur to you rather than hoarding them. This really helps us know how many questions are coming up and plan our time better. We really appreciate it when you do that. It's now my pleasure to introduce our presenter who's been involved with Fear Free since the very beginning. Dr. Valarie Tynes is a diplomate of the American College of Veterinary Behaviorists, as well as of the American College of Animal Welfare. She's an overachiever, apparently. She's part of the Ceva Fear Free Practice Certification Team, a member of the Fear Free Speakers Bureau, and of course, she's a Fear Free certified professional. Thank you so much for being with us this evening, Dr. Tynes, and I will turn this over to you now.
Thank you so much. I'm very excited to get to do this little presentation for everyone because this is really a subject that is near and dear to my heart. Essentially, we're talking about things that cause anxiety for our pets, right? So I could not resist using this little meme as my very first slide, because I found this recently and I was like, yes, someone gets it, right? Even though most of us, myself included, are very excited probably about the opportunity to stay home more and spend more time with our pets, I think what this means is that a lot of times we don't really think about the world from our pets' viewpoint. We don't really see the world from their point of view and think about the fact that some of these things that seem great to us aren't necessarily so great to them. And of course, cats sort of highlight this. We all know that dogs have owners, but cats have staff, right? So this gives us an opportunity to think for a minute about the fact that really for animals, any kind of schedule change can be distressing to them. And yes, schedule changes of all kinds happen in our pets' lives, right? You think about holidays like Christmas, when we come home, maybe we're off for a week at a time if you're lucky, or the kids are home for several weeks at a time, and everyone's there full time, and then all of a sudden everyone goes back to school or to work full time. And if you are suddenly staying home in this COVID environment more than you were in the past, in a few weeks or a few months, you may all of a sudden be going back to work or school full time, and our pets are going to have another big change in their lives. And again, while we may not think of this as a big deal, and for some of our pets it may not be a big deal, for other pets, these kind of schedule changes are stressful. And what I would like veterinarians to start thinking about, because, you know, as veterinarians, what we do is we practice preventive health care, right? That is what we really promote most of the time. So I would like veterinarians to take this opportunity to think about this and start talking to their clients now about this impact of these changes on their pets' emotional and mental well-being, and trying to prepare them, right? Because now is the time that we can actually do something to decrease the chance that the pet is going to have problems when everyone goes back to work or school. Now's the time to prepare them for another routine change. Like anything else, if we wait to see if there's a problem, oh, you say, my pet's fine, they don't care about things like that, but then the problem develops, well, that's when everybody's busy again, right? And they're back at work or they're back at school and they don't have time to deal with a big behavior problem in their pet. And like all behavior problems, or like most of the problems veterinarians deal with, right? Prevention is so much easier than treatment. So that's where I really want to start with this discussion is, let's talk about educating pet owners, right? That our pets are creatures of habit and change can be stressful. And it can result in behavior change that people may not necessarily think of as stress related. Now, obviously things like changes in eating, like if your pet suddenly quits eating, most people will think that is of concern and they will maybe contact their veterinarian and say something about that. But changes in sleeping patterns, maybe not so much unless it goes on for quite some time. But changes in activity or agitation, things like a pet suddenly becoming more active, becoming, again, agitated, maybe showing increased attention-seeking behavior. People may not necessarily identify that as a sign of stress or anxiety, but it can be, and that can often be associated with an increased irritability. A pet that suddenly begins house soiling. A lot of times our clients will say, oh, my dog is mad at me, or oh, my cat is mad at me, when in fact, this can just be a sign that the pet is distressed about something. They are anxious. They are not being vengeful. They are distressed, and we can help them with that. Increased levels of destruction. So a pet may suddenly become more destructive when they are stressed about something, and that's a common sign with certain types of separation distress and even noise aversions. So these are things that people, again, may not associate with stress and change, and things that we can start talking to people about. And ultimately, again, remember that when stress is chronic, so think about pets that maybe have had low-level anxiety-related conditions prior to this, and now they've been exacerbated by more and more change. When stress is chronic and you actually get changes in the hypothalamic pituitary axis, and it can become dysregulated, and the animal starts experiencing all of the things associated with that, lowered white cell counts, increased susceptibility to infection. Basically, you have illness as a result of change and stress. Again, pet owners don't necessarily think about stress leading to illness if we don't talk about it. So it's something that we can be proactive about it, and always, as a behaviorist, I'm always wishing that people would be more proactive and less reactive when it comes to behavior problems. Pet owners tend to want to ask us questions when their pet is exhibiting a problem, right? And they say, my dog is doing this, or my cat is doing that, and I don't like it. How do I stop it? And I always think, wow, if only they had talked to me sooner, we might have been able to prevent this from ever happening, because these behaviors are almost always a result of some condition that might have been prevented. So as veterinarians, think about how you might be able to communicate with your clients now. I know that most veterinarians, the way they've practiced has changed dramatically, right, with social distancing and maybe you're not allowing as many people into your clinic. So if you are doing any kind of client mass communications, whether it's newsletters or email blasts, whatever you do to communicate with your clients, think about this being the subject of one of those commentaries or discussions here in the coming weeks, and start talking to your pet owners now about mentioning problems that they may have seen before this change in lifestyle or before a change in schedule, or maybe even problems that they've noticed since they have been home more with their pets. Because I'm hearing a lot of veterinarians saying that it's amazing how many things their clients are noticing now that they are spending more time with their pets. So they are starting to pick up on some things that very likely were there before, but they just may have not noticed. So now might be a great opportunity to really take care of some of these behavioral issues that often go unnoted. So first of all, be aware that some of your patients are automatically at higher risk for certain conditions, certain behavioral issues. And that, of course, probably the worst case scenario, if we were to grade these at all, might be those patients that already have separation anxiety or noise aversions or phobias or any other form of anxiety-related condition, but also senior pets and a new pet. Maybe these are one of those individuals that decided, oh, what a great time to go out and get a new pet or adopt a pet or foster a pet now that they're spending more time at home. And those animals are going to have their own unique risks. And then, of course, if they decided it was a great time to get a puppy and kitten because they were going to be spending more time at home, those animals also have a unique risk of their own. And I'm going to speak about each of those as they're one at a time as we get to them here. So let's take puppies first, all right? I'm worried about puppies for a variety of reasons. Anybody that decided now was a great time to go get a puppy, I love it on the one hand, because maybe if they're going to be home for a month or so, it is a great opportunity for getting that puppy house trained while that people can be able to spend more time at home with them. Hopefully, the pet owner is making some efforts at doing some socialization. We don't have time to really talk about how they would go about doing that, but it's obviously going to be exceptionally challenging in this time, but there are things they can be doing. But puppies are probably going to be a little bit of a concern when it comes to the fact that somebody has been home with them potentially 24/7 for a couple of months, and then now there's a chance that soon everyone's going to be gone for 8 to 10 hours a day. That's a huge change for a puppy. And while we really do not know what causes separation anxiety in dogs, one of my big concerns for puppies, and one of the things I always recommend, is that people try to teach puppies how to be alone. And that's really hard, right? When you get a new puppy, everybody wants to love on it all the time. But we need to be sure that we begin teaching puppies how to be alone. And hopefully people are using a crate to house train their new puppy, and they recognize that just because the puppy goes in the crate willingly and stays there for a short period of time, that doesn't necessarily mean that the puppy is okay there alone when the owner is gone. So they need to understand that periodically they should put the puppy in the crate and take a short walk by themselves, or just leave the house, go outside and do some yard work. So very short periods of time where the puppy is alone in the crate, and then very slowly extend that period of time will be helpful. Be sure that they understand the importance of making crate time very, very positive. And they should do this every time by giving the puppy some sort of treat. But as they extend the time that the puppy stays in the crate, be sure that they're leaving longer lasting special treats with the dog. And by that, I usually mean things like food toys, food puzzles, or foraging toys like you see here. This is a Tug-a-Jug by Premier, what used to be Premier. I think it's called Pet Safe now. But if you go online, you can find all kinds of food or foraging toys like this, and I highly recommend them for all ages of dogs. Be aware that a dactyl could play a very useful role for the puppy at this age. A dactyl's been around for 20 years. This is a copy of the canine appeasing pheromone. So this is the pheromone that mother dogs begin producing at about the time they have their babies and stop producing at about the time they wean them. But the data from the last 20 years, the multiple research studies show that dogs continue to be able to recognize this pheromone and that it can be very useful at decreasing the distress shown by puppies when they are first brought into the home. So hopefully your clients are already using it, but it also appears to help puppies learn more quickly and become better socialized if they wear an adaptable collar, for example, during the first month or two after you have them home. Generally speaking, adaptable seems to help puppies adapt better to that new home. So if you're using adaptable during this time of change, I think that could potentially be very helpful. And then again, last but by no means least, encourage people to think about setting a schedule that they're going to be able to keep when they go back to work or to school. Now, maybe if they think that's going to be a month or two away, they don't have to do that now, but they could very slowly begin working towards that. So begin increasing the amount of time that they leave their puppy alone so that it is a gradual change instead of a sudden change, and let that puppy become used to what the world is going to look like for them when suddenly people are not there all day long. As for kittens, again, maybe not quite so challenging depending on the cat's personality. And every kitten, every cat is different. Excuse me. Some cats obviously are more social than others and appreciate and desire more social contact than others, but some are less needy. But if people have adopted a kitten at this time and have adopted a singleton kitten, they do want to be aware that this kitten may need some preparation for being alone. And honestly, what you see here are a lot of my recommendations for any time someone gets a kitten. I'm always amazed at the fact that people think you can get a little tiny kitten and turn it loose in a couple of 1,000 square foot home and expect that it's going to know where to go to scratch and it's going to know where to go to use a litter pan. So if you are going to take this kitten and then leave it alone, it might be a good idea for this kitten to have a place that's safe and cat-proofed for it. And it doesn't necessarily have to be a cage, although I give you a picture here of a nice cat. Actually looks like a little catio, but it could be a room for the cat that it's confined to when nobody can be there to watch it. And be sure that wherever the kitten is confined to, that it has plenty of raised hiding spaces, that it has appropriate scratching posts, that it has a litter box of the appropriate size. Because I put this picture in here because it's the best example I have of a adult cat in a litter box that is too small for it. But we can do the same thing with a kitten. We can give a very small kitten a box that is too large. And we need to be aware that when that kitten is small, it needs a box that is easy for it to get into. And then we need to give it a larger and larger box as it grows larger. Ceva is, again, another product that can be very, very useful to help cats deal with certain stressors. Ceva Classic, the original Ceva, that is a copy of the facial pheromone. Again, this is the product that's been around for 20 plus years. This facial pheromone that cats leave when they rub their face on things in the environment has been shown to be a pheromone that tells the cat, this is a safe place for me. And when Ceva Classic has been studied in all of the different contexts that it's been studied in, it has been shown to help the cat feel more comfortable about change. Basically, it's been looked at for travel. It's been looked at for when you move and the cat has to make a move into a new home. So this is a very nice place where you can be recommending Ceva to help this cat or kitten be more comfortable in this new home and hopefully adapt to the changes associated with these changing schedules. Now, if this is a multi-cat household, be aware that all of these things are even more important. It's important that there be multiples, because one of the greatest stressors in the multi-cat household is inadequate resources. So leaving these cats and going back to work or school and being gone for many hours of the day means that people may not notice that this new cat is not getting along as well with the other cats in the home. So people want to be aware of all of the needs that the multi-cat household has, and be aware that Ceva Multicat is a copy of feline appeasing pheromone, and it has been shown to help decrease conflict in multi-cat homes. So that's where it might play a role. And I just wanted to mention it because so many people still don't recognize the difference between those two products. They are two different pheromones with different applications. Lastly, but again, no less important, consider feeding cats and foraging devices. Again, feeding toys, if you will, and requiring cats forage for their food. Whenever you can do this, this is a means of enriching the cat's environment or increasing their use of their natural behavioral repertoire. And anytime you do that, you have the potential for decreasing stress in an animal, right? All right, let's just talk about new pets. Again, this pet owner, maybe they went to a shelter and adopted an adult animal, or they are just fostering. Either way, we have an animal that has gone from what was potentially a very stressful environment, a shelter environment, and has a history that we know nothing about. So they've experienced stressor after stressor. Now they've come into a new home and have been expected to deal with a new environment. And now we're asking them to change again. So most importantly, I want people to be aware of the repeated stressors that these animals may be facing. And I mentioned crates, kind of, here in the middle, refer to crates, but also comment that if this animal is already showing that it is well house trained. Again, crates may not be necessary, but you may find that confining them to a portion of the house may be necessary to keep them safe, depending on the size of the house. But the big point I want to make here is to be sure that people understand that if they have brought a new pet into their home that acts fearful or distressed about going into a crate or being confined in any way, it is critical that you never, ever force an animal into a crate that acts distressed about it, okay? And this really applies to whether we're talking about puppies, going to be an important point when we talk about separation anxiety in a minute. This is the way to make these animals worse. So be sure your pet owners know that if this is a problem, they need to consult a behaviorist, okay? We don't just force them into a stronger crate. We don't just build a stronger fence or a higher fence. An animal that can't be confined has an anxiety disorder, and they need help, okay? And that's really a discussion for a whole nother presentation. Another patient that is going to be at potential risk are our senior pets. And this can be from a variety of different reasons. One, of course, is the loss of sensory perception that they are experiencing. Another may be due to actual cognitive decline if they are experiencing that. And of course, the other is chronic illness. Mainly, again, we want our clients to be aware that when their pets are starting to lose their sense of hearing and vision, or, you know, both or one or the other, this is something that we can't change, and we may not always recognize it, but it affects how they perceive their world. It limits them. It can allow them to be more easily startled, and it often leads to increased anxiety and irritability just on its own. If you then add things like chronic illness and potential pain or discomfort, that can add up and create even more anxiety for them. And if they're experiencing cognitive decline, which again, this is a irreversible, progressive, degenerative brain disease or condition of aging animals, we need to be aware that that affects their ability to cope with change. As animals age, they lose their ability to cope with change anyway. And so their needs for routine grow, and we also have data that shows that nutritional support in the form of things like Phenolife, it contains a lot of antioxidants and things that have been shown to help the brain. Enrichment in the form of things like foraging puzzles and positive reinforcement training, all of those things can be very helpful. But what we have now is anything but routine, right? So again, beginning to get them used to a schedule that we will be able to keep when we all go back to work or school is going to be very helpful. And being sure that their pain is controlled. I cannot overemphasize the importance of controlling pain, because I see many animals exhibiting anxiety because their pain is just not under control. And last, but again, by no means least, let's take this opportunity, if you can, to deal with any pre-existing anxiety-related conditions. Because if you have owners that are now spending more time at home with their pets, they may be noticing things that they hadn't noticed before. It's spring. For many people, they are seeing thunderstorms, and they may be seeing how their pet responds to thunderstorms when they maybe didn't see that so much in the past if they were gone a lot of the time. Certainly, if a pet has mild signs of separation anxiety, these owners may not be seeing that because it happens while they're gone. And I would suggest to you that some of these noise aversions and separation anxiety, these are classic examples of where animals suffer in silence. And it is distressing to me because, again, over the last 20 years or so that I've been practicing behavior only, I feel like I see this a lot. I see animals that probably were showing very minor signs of anxiety, panting, pacing, salivating. You know, owners may say, oh, you come and look for me, and they want to hide under my legs when there's a thunderstorm. And those are things that owners, again, may not think of as being a really big deal. That may not be a big problem. It's not a problem for them. But when it is ignored, when it is allowed to continue, the likelihood of those clinical signs progressing and getting worse is very high. And what happens is eventually separation anxiety, for example, may become serious enough, or the animal may become distressed enough that then you see destruction in the home, then you see house soiling, then you get vocalization, and these other signs that become a problem for the owner. Well, at that point, this is a very hard problem to treat. And the same thing with the noise aversions. What may begin as a mild aversion can become a full-on panic attack where animals are ripping their claws out, knocking their teeth out, or going through plate glass windows in a panic. And rather than wait until things become that bad, if we would ask owners about these problems early on and find out that they exist, we can educate them about trying to help these animals before the problems become severe. And being aware that there's a very high incidence of comorbidity with these conditions may help as well. If a client mentions that their pet is nervous about thunderstorms, then that gives you an opportunity maybe to ask about separation anxiety, because there's a very high incidence of both. So that said, just be aware if you're getting some comments about this or complaints about this now. Again, now is the time that clients can do something about this, because they are present. They don't have to leave their pet alone. So all of the things that we've been talking about can be helpful. Again, maybe we can start teaching them how to be alone gradually by giving them a comfy, safe place, providing them with food puzzles, and seeing if they can learn that their owner can just leave the room for a few minutes and come back. And then slowly increasing the time that the owner can be gone. Using Adaptil can be very helpful. Adaptil in a trial compared to clomipramine was shown to be able to decrease the signs of separation anxiety to the same degree, okay? And this just demonstrates really the importance of behavior modification whenever we're treating a behavior problem, right? Drugs, nutraceuticals, any intervention like that can only take us so far. Behavior modification is usually going to be needed too. But Adaptil can be very helpful at decreasing the signs associated with separation anxiety. It's also been shown in studies to decrease signs associated with fear of thunderstorms and fireworks. But if Adaptil is not enough, what we need to be aware of is that there are some wonderful nutritional support or nutraceuticals out there that also may be useful and can be used in conjunction. And using these things in addition, adding things to others is potentially going to allow us to use less medication if we need to use medication, if the noise aversion actually becomes a phobia, if the separation anxiety is so severe that we need pharmaceutical support. So be aware of all of these things that we can use to decrease anxiety in these animals, and don't be afraid to use them all, because again, we don't want these conditions worsening the minute people go back to work or school, and that's what will happen. And remind them that the best way to know really how bad this patient is when they leave it is to get video. And getting that video now, when they can potentially just take a drive around the block, again, this is the time to do it. So this is just a great opportunity for people who have dogs with these conditions to see how bad they are and to try to get a handle on them before they go back to a full schedule away from home and it becomes even more difficult. So I understand I've gone over a little bit. Just to summarize, remember that these abrupt changes, even though they may seem great because we get to be home with our pet more, can still be stressful for them. Any change can be stressful for them. And let's encourage our clients to start now to prevent problems rather than be reactive and wait until they occur. Think about our higher risk individuals and remember that there are these basic things that we can do, like slow habituation to help the animal learn to be alone, using things like pheromones and food puzzles and treats to make being alone more positive. I thank you, and I hope if you have any questions, anything I went through too quickly, anything you'd like to cover in more detail, that you won't hesitate to ask. I'm happy to answer questions.
Thank you so much, Dr. Tynes. That was fantastic, and I love your little memes there and your little dog destroying the toilet.
I couldn't resist.
It causes us all deep pain to see that. So we're going to hope that happened a long time ago. We do have some questions, and if anyone has additional questions, please type them into the Q&A window rather than into the chat window. It makes it easier for us to manage them. The first question was something that you mentioned but didn't go into at all, was the recommendation for puppy socialization, that this is something that people are hearing a lot about from their clients and their colleagues. What can we do to socialize puppies during this time?
You bet. I can run through a few things. It is extremely challenging because one of the things we can't really do, right, is let them meet people close up, face to face. But other things that we can remind them to do are to be sure that their puppies get exposed to lots of surfaces. So remind them that getting their puppy out on a variety of surfaces is important. Be sure that that puppy doesn't only spend the first few months in a house on hardwood, right? Let them get onto different surfaces, gravel, concrete, grass. You know, if you can get them into some water, that's great. Be sure, if possible, and one way they can do it, I admit, would be going online and downloading some audio recordings. And let me see if I can remember. I'm pretty sure there is still a place online you can get one that's called Sound Scary. I could be wrong. I haven't checked that in a while. But there are places online where they could download recordings that include things like children at play, like a noisy schoolyard, loud equipment like road equipment, maybe even, again, fireworks, gunshots. If you, maybe this is a hunting dog, but people aren't able to get out hunting. And try to expose the puppy to a variety of different sounds. And again, this should all be done in a very positive manner, stopping if the puppy acts distressed. Ideally, in socialization, we want it to be the puppy's choice. We want them to be able to approach something that's new and potentially scary. And then, of course, you want to give them treats and make it all positive. Again, as often as possible, if you have close family members that are practicing their social distancing and they are not sick and haven't been around anybody sick and they've been home quarantined, take advantage of that If you are able to get out in your car, you can take your puppy for drives in the car and just let it see the world, even if you can't let it meet people. Hopefully, maybe get them the opportunity to see people in uniform. You know, think about where you can drive them and let them see out the window and see a variety of people. I even read one little article they talked about take the opportunity to play dress up, especially if you have kids. You know, you can get out the Halloween costumes and the hats and the glasses and let the puppy see you in different get-ups so that you can get them more familiar with things like that. I know it sounds kind of silly, but it is, those are things you can do. So you do have to be a little creative, and it is by no means ideal, but it is absolutely better than doing nothing. And I know I've seen several articles online written by some of the, you know, good trainers out there, good positive reinforcement trainers. I thought I saw something on IAABC. There's people out there trying to give good suggestions for doing this. And maybe that's the next fear-free webinar. If y'all haven't done one of those yet, we need to do one.
Actually, I think we did, and I think we also have some other assets on puppy socialization, both coming up.
Okay, good.
Already done, yeah. So if you go to fearfree.com/webinars, you'll see all of our past webinars.
Excellent, good. Yes, I thought some of it, what I had seen had been from y'all, but I couldn't remember now. I've seen several useful little things. So it's out there. It's just going to take some effort.
Right. Well, none of us has lived through anything like this. And as someone who has a puppy, he's a little older,
Exactly.
so it wasn't critical for me, but I am dealing with, he was just about to start an enrichment and training class. It's more like trick training rather. I don't like to get them bored in obedience because I get bored.
Right.
But this is more fun.
Right. Exactly.
And then this happened, and so now I'm basically just trying to expose him to new things without leaving our property. And I live in the woods on 4 acres, so it's easy. But this has just been so challenging for people.
Exactly.
And
I'm in a similar position. Yeah, with a young dog. I live in the country. I can do a lot more, but I've really been thinking about that. Oh, you know, people that don't have those opportunities. They live in a busy city. And yeah, it's obviously it is something. So I'm glad people are thinking about it. Thank you for whoever for asking that question.
Yeah,
because we do have to think about it and we have to be creative. We're worried we're going to have a whole population of scared dogs in a year or two.
Well, we don't want that. There's another question that I think everyone will relate to, both for their pets and for themselves, that one person noticed that their pet seems to be hungrier these days and is wondering, are they just paying better attention because they're home, or is this stress related? Do pets stress eat like we do?
I would not hesitate to say that could happen. I'm just one of those people that I never say never, and I see no reason why they might not do that as a means of, you know, it's just like a redirected or a displacement activity. They don't know what else to do with themselves, maybe. I do agree that it's possible in so many cases that, again, if you haven't spent this amount of time with your pet, you are going to see things that you had not seen before.
Right.
But at the same time, I would not doubt that we could see a pet eating more as a result of stress. And that's why I kind of say appetite changes, because I believe it could go either way, just like sleep pattern changes could mean more sleeping or less sleeping. I really do think with stress, it can go either way.
Yeah, well, it does for me. I'm vacillating between insomnia and wanting to sleep for 15 hours.
Exactly. And I don't Yeah.
Yeah. Okay.
I think there's enough similarities in our mammal brains that I wouldn't argue that could happen.
So another question that we've been hearing a lot from our site users is someone who adopted a dog a month or so ago, and the dog cries when, this is about her own dog, when she goes outside. This is a 1-year-old dog. She's been doing the Kong toy with the treats, walks him before she leaves, has been using a hemp treat. Is there, what should she do next? What's the next step?
Well, I would kind of want to ask a little history, so the things that I ask people to consider in this scenario are, is this also a dog that, can this person go to another room of the house? The question we often ask, can you go to the bathroom and close the door without the dog wanting to go with you? That is often a sign that kind of tells you how attached this animal is, how distressed are they about you being out of sight. And when you have that degree of attachment, I tend to say, that's a little extreme, and maybe you do need a little bit of help in addition to the behavior modification I would recommend. And when I talk about help, I tell people, go where the data is, and we have data supporting Adaptil. We have data supporting L-theanine as being able to decrease some anxiety. We have data supporting alpha-casozepine. We don't have much good data on things like hemp, right? So I do encourage people to look for what we can support and use those things first. And if those don't give you the help you need, this pet may need a mild anxiolytic. So that's something to consider. But I often I would want to do some positive reinforcement training with this pet and teach them to, sit and stay. And you want to gradually teach a sit and stay and extend it to, can you just, walk around the corner out of sight in the house? And then you want to be able to extend that to, can you walk outside? It just has to be very, very gradual. And if this is, the person that's asking is someone that's not extremely trained in how to train dogs, they may need some professional help in how to do that. The other thing I would mention, though, I'm glad this occurred to me, there is a device called a Treat and Train, which is a wonderful tool. Yeah. And we might encourage people, consider that if you don't mind spending a little money. I don't think it's crazy expensive, but it's a great way. What I love about it is you can reward the dog without having to return to it. So there's something about that I think can be very, very helpful, so that we want to teach that animal that it's okay to be alone, right? So you can progressively reward it for being alone for longer and longer and longer periods of time. Again, starting with seconds and proceeding to minutes, but it's rewarded while you're gone, not by your coming back, which I think can be very, very valuable. I think that's where we get stuck a lot of times in trying to do behavior modification with separation anxiety. So hopefully that helps a little bit. Those can be tough cases, and the help may need to be tailored to the individual, but hopefully that's a starting place.
Someone's asking for a link to the Adaptil. I think this was mistyped. I think it's clomipramine study. Is that correct? Did you
the Adaptil clomipramine study?
Did you mention that? I'm not sure.
Yeah, I did. I did mention there is a study, and oh goodness, where was that published? It might be easier for them to email me and I can give them a copy. But, you know, if they go on Google Scholar, they could look it up. But I have a copy and I'd be happy to share it with anybody. And I'm pretty easy to find on the DACVB website. I realized I didn't put my email on this.
Oh, okay.
I'm
well,
trying to remember.
Or if anyone just wants to email it to fearfreepets@gmail.com, I pick that mail up and I'll be happy to forward it to Dr. Tynes. So fearfreepets.
Okay, yeah.
Yeah, just email
Thank you.
me, I'll send you the link.
Yeah, I think that was published in the Veterinary Record, now that I think about it. I think that's where that particular study was published.
Yeah, I tried to Google it myself and I wasn't sure which study it likely was. So we'll let you, track that down. Okay, great. Thank you so much.
Let them ask specifically and I'll be sure and look that up for them.
Terrific. So a few other questions. Someone wanted to know the name of the product you're currently talking about while you were talking 2 minutes ago. I'm thinking that was, thinking this is the train, and someone else just asked again as well. I'm guessing here that they're asking about treat and train.
Yeah, so I could repeat, the treat and train, which treat and train, and I'm pretty sure that is still the name, right? Because it went under 2 different names.
No, I think that's the new name.
At different, Is it the treat and train? Okay, good.
Sure. Yeah.
Now, they might have had questions about the L-theanine and the alpha-casozepine, and I don't have a problem mentioning trade names if you don't mind me mentioning it. Vetoquinol is one of the sponsors too of Fear Free. So
doesn't matter.
Yeah, Vetoquinol makes Zilkine, and I think that's one of the better sources of alpha-casozepine, or it's one that's been studied. So if that was what somebody was asking about, I'll repeat that. L-theanine, the amino acid that's found in green tea, is in a product made by Virbac called Angstine. It's a terribly underused product.
I love that product. I have a cover.
Yeah, and L-theanine is found in a lot of other products out there in different amounts and combined with other ingredients. But again, Virbac did some nice studies on Angstine and the L-theanine, and so it's a product I know more about, I guess I would say.
Yeah, no.
So maybe just in case, I'll say that again.
Yeah, we're trying to cover the bases for everybody here.
Yeah, exactly.
So here's another question. When looking at something like Happy Hoodie or a Calming Cap that work to reduce anxiety, but why do those work to reduce anxiety if dogs become anxious when they lose their hearing and their sight?
That's a wonderful question. So I believe, and again, this is a great example, there's not a whole lot of research behind that particular product. And I think it depends very much on the individual you use it on. So in my experience, and based on what my colleagues say who use that product, probably more than I have, you use that on an individual that is stimulated, or triggered by visual stimuli. So if I have a patient that gets very aroused because it sees other dogs, then I might find that useful while I'm in the process of behavior modification and I need to be able to take that dog for a walk, because it might help us keep that dog below threshold. Okay? So again, it's for a very specific use and a very specific patient. But that's a great question. I think for dogs that lose their sight, again, in a family situation and it's constant and it's unexpected, for the average dog, that's distressing because they can't read the visual cues of their housemates, if it's a multi-dog family, I see most problems in those situations. And that can lead to problems. Or like I said, if somebody can, sneak up on them, or they don't see a person reaching for them and they're an anxious dog, they can be startled. So again, it depends on the individual.
We have time for two more questions. So the first one is, what would you recommend to veterinarians and trainers to, in terms of resources or tools or advice for owners to help them look for and recognize subtler changes in their pet's behavior?
Great question. I think the first step, is getting people to be excellent readers of body language. And this is very common, I think, especially amongst pet owners, that they just aren't aware of the subtleties of dog body language. And that's where I see the most problems occur. Even in the veterinary clinic, when I see problems, with people getting bitten, it's usually because people didn't recognize the body language, the signals that dogs were sending. So there's, some good YouTube videos that I send people to sometimes. One of them is, that I can think of off the top of my head, is Zoom Room. I believe they call Zoom Room. There is one, it is aimed more at children, but it's the one that is also coming to the top of mind, called I Speak Doggy, and I think it may be made by the Family Dog, so that might be a resource for some people. Again, it's aimed at children, but it does give some good information.
And we have quite a few at fearfreehappyhomes.com as well.
Yes, and right, and I was going to say, that's one of the great things that y'all do is educate about reading, the importance of reading visual cues. Mm-hmm. There is a wonderful textbook out there, and I believe the last name of the owner is Handelman, Barbara Handelman, and it is a wonderful text on canine body language, but I am totally blanking on the name of the book.
Well, maybe,
but it is a...
Yeah, you can dig that up. If anyone emails, I can share that with them as well.
Oh, actually, it's called Canine Behavior, a Photo Illustrated Handbook.
Oh, wow. That sounds great.
So good thing I didn't have to walk too far to get it. And it is Barbara Handelman. Yeah, lovely, lovely book for people that want to improve their skills at understanding dog body language.
Oh, Dr. Landsberg just shared with me the link to the journal article from the veterinary record that you were discussing, and I just put it in the chat window. Yeah.
Oh, great. Good job. Thanks, Gary.
Yeah, thanks, Gary. From all of us. Gave me a lot of help. So we have one last question, but we are kind of out of time, and it's a very lengthy question. So with all apologies, it was a 3-part question. I'm going to skip the first 2 parts and go right to the practical one. And how long would you recommend using Adaptil during the transition when we go back to work, if we ever do?
I would recommend at least a month. So like the collars last a month, so they could use a collar for a month. And then otherwise it would depend on if the dog had any pre-existing problems that they're trying to deal with, or, the age of the dog. I have to admit, on puppies, I love it if they can wear, a collar every month for 2 or 3 months, maybe longer. But I would say a minimum of a month.
Great, thank you.
For the average.
Well, that is all we have time for. Thank you so much for being with us, Dr. Tynes. And thanks again to all of you for being here and to Ceva for making this presentation possible.
Thank you.
Yeah, we have a number of webinars scheduled for this week, and we're adding more all the time. You can follow our schedule at fearfreepets.com/webinars, which is also where this recording will live when it is processed. Thanks again to everyone. Please stay safe and make sure you care for yourselves and not just for everyone else during this hard time. Thank you, everyone. Good night.
Thank you. Good night.